Vitamin D is part of a group of fat-soluble vitamins, which also includes vitamins A, E, and K. Vitamins that are fat-soluble travel through the lymphatic system of the small intestines and into the blood, which circulates throughout the body. A balanced diet is very important for maintaining a healthy amount of fat-soluble vitamins in the body. Too much vitamins could actually be detrimental for your health.
I mean, there's a lot of women out here that's just, they just deficient in so many things, man. Missing so many key nutrients in your life. I just want you to stay healthy in these streets, Somebody gotta give you some vitamin D,
What Ludacris said in his song was true. Vitamin D is important for maintaining a healthy lifestyle for both men and women. Vitamin D, which is also called cholecalciferol, is a group of fat-soluble steroids responsible for increasing intestinal absorption of calcium, magnesium, and phosphate. It is a hormone that is involved in mineral metabolism and bone growth. Vitamin D exists in two forms: vitamin D3, which is produced naturally in the body through sunlight, and vitamin D2, which is also called ergocalciferol, which is acquired through supplementation and diet. For vitamin D to be useful for our health, we need vitamin D in its activated state. Metabolic activation consists of adding two separate hydroxyl groups. One of the hydroxyl groups gets added through the liver, while the other one gets added as it processes through the kidneys. Vitamin D comes in three inactive forms. The first inactive structure for vitamin D is called cholecalciferol. This is naturally formed by our bodies after exposure to sunlight. The second inactive form is called ergocalciferol. This is also called vitamin D2. Vitamin D2 comes from plants and fungal sources. The third inactive form is called 2,5-hydroxycholecalciferol. This is naturally made in the liver. It is the most abundant form of vitamin D found in the blood, and it is the form measured in blood tests. It is a metabolite that signals the presence of vitamin D in the body. Before vitamin D becomes metabolized, it exists in its ineffective structure. This inactive form exists both in vitamin D3 and also in vitamin D2. In this presentation, I'll be showing you the inactive forms of vitamin D3, and as you can see to the right, I have a structure of the first inactive form of vitamin D3, which is called cholecalciferol. It then becomes converted to form 2,5-hydroxycholecalciferol, and the structure is there on the left. You can see that the difference is the addition of the hydroxyl group. We can now start exploring the active structure of vitamin D. The active form of vitamin D is called 1,2,5-dihydroxycholecalciferol. Vitamin D must be lastly metabolized by the kidneys to form this active structure. By being metabolized by the kidneys, it adds an extra hydroxyl group, which gives it a total of 3 hydroxyl groups on the molecule itself. After being activated, vitamin D will bind to its receptors and turn on numerous genetic activities, which we will explore further on in this presentation.
Diets and supplements. It's important to eat a healthy and balanced diet to obtain vitamins and minerals which are necessary for proper growth and development. Foods such as vegetables, fruits, whole grains, and certain fortified vitamin D products like fat-free milk, yogurt, and cheese can be eaten to get vitamin D. Seafood, lean meats, and poultry also contain vitamin D. Fish oils from salmon, tuna, and swordfish also contain high concentrations of vitamin D. If you are not getting normal amounts of vitamin D from foods in your diet or adequate sun exposure, the alternative is to take vitamin D or a multivitamin pill. Since age is a factor in determining how much vitamin D is normal, we can approximate a level around 600 to 1,000 international units as the typical or average amount of vitamin D that someone should be obtaining. According to the chart, cod liver oil contains the highest amount of vitamin D per serving. At 1,360 international units, cod liver oil, a fish oil, can also be taken as a pill. These oils are very easily absorbed into the body, which is why many prefer to take fish oil pills as a supplement for eating certain seafood. Other foods that contain vitamin D include eggs, where vitamin D is found in the yolk, and also certain cereals, which contain fortified vitamin D. Some of the most popular supplements for vitamin D include One-A-Day Women's and One-A-Day Men's. They both contain the type vitamin D3, and they vary in international unit amounts. You can speak to your doctor or pharmacist to find the best dosage of vitamin D for you. A normal level of vitamin D is at 54 to 90 nanograms per milliliter. You can also have an excess or an intoxication of vitamin D, which would have an amount greater than 100 nanograms per milliliter. An insufficient or deficiency of vitamin D would be at levels ranging from 20 to 32 nanograms per milliliter. A deficiency is any level lower than 20 nanograms per
The
milliliter.
most common cause of vitamin D deficiency is inadequate
result in
exposure
rickets.
to sunlight. Since less exposure to sunlight prevents our skin from making vitamin D3, an important fat-soluble vitamin that is essential for formation, growth, and repair of bone, along with enhancing immune functions and improving muscle strength. Not consuming enough vitamin D in a person's diet can also be an underlying reason, especially for those who stay indoors for the majority of their time in a day, preventing exposure to the sun. It is also important to note that babies are at high risk of vitamin D deficiency since breast milk does not contain adequate amount of vitamin D. Breastfed infants who are not exposed to enough sunlight are at a risk of vitamin D deficiency and rickets. In a case of malabsorption disorders, people who are affected by disorders cannot absorb fats normally, meaning that the body may not be able to absorb enough vitamin D from foods. Since vitamin D is a fat-soluble vitamin, which is normally absorbed with fats in the small intestines, less vitamin D may be absorbed from the intestines as people age. Certain kidneys and liver disease disorders and several rare hereditary disorders, such as hypophosphatemic rickets, can lead to a vitamin D deficiency, since it prevents the activation of vitamin D to its active form, which is essential since the active form of vitamin D is responsible for various metabolic processes, such as promoting absorption of calcium and phosphorus from the intestines. Older people are more likely to develop vitamin D deficiency for several reasons, such as their requirement for vitamin D are much higher than those of younger people. They tend to spend less time outdoors and thus are not exposed to enough sunlight. They may not be exposed to enough sunlight because they are housebound, live in long-term care facilities, or need to stay in the hospitals for a long time. When exposed to sunlight, their skin does not form as much vitamin D as a normal person. They may consume so little vitamin D in their diet that even taking vitamin D supplements in low doses, such as 400 units per day, does not prevent the deficiency. They may have disorders or take drugs that interfere with the processing of vitamin D. And so it is advised that older people should take 800 IU of vitamin D each day to keep their bones healthy, as well as periodic blood tests to check their levels of calcium, vitamin D, and parathyroid hormone. Although it is important to note that these symptoms may potentially indicate signs of vitamin D deficiency, they alone themselves do not necessarily correlate to the deficiency, meaning that a person who have any of these symptoms should go see their physicians for further tests to confirm. Some signs of vitamin D deficiencies are muscle aches in the case of muscle spasms, which may be the first signs of rickets in infants. These spasms may also occur in adults. They are caused by a low calcium level in the blood in people with severe vitamin D deficiency. If pregnant women have vitamin D deficiency, their newborn may have spasms. The spasms may affect the face, hands, and feet. If the spasms are severe, they may cause seizures. Since vitamin D directly correlates with calcium and bone health, a deficiency may lead to a significant decrease of bone strength, thus increasing the likelihood for an individual to suffer from bone fractures. Hypersensitivity to pain is also normally associated with vitamin D deficiency, since the bone in adults, particularly the spine, pelvis, and leg bone, are weakened. Rickets, most commonly found in children, can also occur, usually from extreme and prolonged cases of vitamin D deficiency. Vitamin D deficiency can be diagnosed with a given blood test to measure vitamin D, which can confirm the deficiency. X-rays may also be taken. The characteristics changes in bone may also be seen on an X-ray before symptoms may become noticeable. Regular checkups conducted by a doctor may also lead to a diagnosis. If a person reports an inadequate diet or inadequate exposure to sunlight to the doctor, or older adults, especially for those with decreased bone density or broken bones, such as the case with osteoporosis. People who are at risk of vitamin D deficiency should take the proper amount of vitamin D recommended by their doctor, as well as increase exposure to sunlight for an adequate amount of time, which is advised to be at least 15 minutes a day. If muscle spasms are present or calcium is thought to be deficient, calcium supplements are also given. If phosphate is deficient, phosphate supplements are given. Usually, this combination of treatment leads to a complete recovery. Vitamin D toxicity, also called hypervitaminosis D, is a rare but potentially serious condition that occurs when you have excessive amounts of vitamin D in your body. Vitamin D toxicity is usually caused by a megadoses of vitamin D supplements, not by diet or sun exposure. That's because your body regulates the amount of vitamin D produced by sun exposure, and even fortified foods don't contain large amounts of vitamin D. Taking very high doses of vitamin D, for example, 60 to 100 or more times the recommended daily allowance over several months can cause toxicity and a high calcium level in the blood, which can lead to hypercalcemia, in which levels of calcium become high because when the levels of vitamin D are high, more bone is broken down than is reformed. Normally, bones are continuously broken down and reformed in a process called remodeling to adjust to the changing demands placed on them. As a result, calcium is released from the bones into the bloodstream. It can also be caused by more calcium being absorbed from food in the intestines. The main consequences of vitamin D toxicity is a buildup of calcium in your blood, hypercalcemia, which can cause nausea and vomiting, weakness, and infrequent urination. Symptoms might progress to bone pain and kidney problems, such as the formation of calcium stones. Because the calcium level is high, calcium may be deposited throughout the body, particularly in the kidneys, blood vessels, lungs, and heart. The kidneys may be permanently damaged and malfunction, resulting in kidney failure. Vitamin D excess is usually diagnosed when blood test detects a high calcium level in a person who takes high doses of vitamin D. The diagnosis is confirmed by measuring the level of vitamin D in the blood. Treatment of vitamin D toxicity involves stopping vitamin D supplements for a while to offset the effects of high calcium levels in the blood. Fluids are given intravenously as needed to bring the body back into homeostasis. Drugs such as corticosteroids or bisphosphonates are also given to suppress the release of calcium from the bones.
The main functions of vitamin D is that it increases the level of calcium in the blood by promoting an absorption of calcium ions from the gastrointestinal tract from the food we eat. It also stops parathyroid glands from increasing. Without vitamin D, the parathyroid gland has no signal to stop and therefore just keeps growing. This can lead to hyperparathyroidism, which is when we have too much of it. So, how does it work in the body? Well, the body only makes one type of vitamin D, vitamin D3, while nature makes the rest of the types. Vitamin D needs a few steps before becoming active. It first needs to be converted into calcidiol, which can be done through the liver. It is then converted into calcitriol in the kidneys. This step is controlled by the parathyroid hormone and the concentration of calcium and phosphate and calcitriol in the blood. When our vitamin D is finally active during the last step, it starts to circulate into the blood. When it reaches the cell, the vitamin D then binds to a vitamin D receptor. The vitamin D binded to a vitamin D receptor then in its entirety binds to a retinoid X receptor, which has a vitamin A bind to it. This makes a huge complex form with a vitamin D receptor, an RXR, and a vitamin A, all that gets sent through DNA, which can start transcription. This can then allow the body to use the vitamin D however it wants. All in all, vitamin D is a very important vitamin needed by the human body. We really appreciate you listening, and we hope that you learned something that you didn't know before. Thank you and have a great day.